So non-alcoholic fatty liver disease is really the disease that is a liver manifestation of obesity and metabolic syndrome. It's really a phenotype, so a number of different sort of pathways lead to this disease. The most common one is the one that is associated with obesity, type 2 diabetes, and insulin resistance that causes fatty liver disease. We've recently published the global epidemiology of non-alcoholic fatty liver disease, which estimates about a quarter of the world population have non-alcoholic fatty liver disease. And the prevalence is quite high in the United States, about 24%, and similar in Europe. But one of the highest prevalence rates that were really a bit surprising to us was that the highest rates were for South America and Middle East. And in Asia, the prevalence of non-alcoholic fatty liver disease is also increasing. Now, from the spectrum of non-alcoholic fatty liver disease, a subtype is called NASH, or non-alcoholic steatohepatitis. That's the group of patients that can progress to cirrhosis, that can cause liver cancer or liver mortality. So in 2013, 2014, we have looked at the UNOS database for liver transplantation. Currently, NASH is the second indication for liver transplantation in the United States. For liver cancer, it's one of the top 3 causes of death or liver cancer in the U.S. So it's becoming an important disease because it is very common, and a subgroup of patients can actually progress. So it causes a clinical burden because it's common and it progresses to liver disease potentially. It also has a patient experience sort of burden, meaning that it impacts patients' quality of life, their work productivity. There is a significant fatigue associated with that. In addition to this, there is an economic burden with non-alcoholic fatty liver disease. In this meeting at the American Association for the Study of Liver Disease in Boston, we just presented a paper that looked at the economic burden of this disease in the US and 4 European countries. Just to tell you that, and I'm taking a very conservative approach to our model. This is a Markov model that we have developed. The economic burden of NAFLD would be at least about $103 billion in the United States, potentially. And then when you add this, the European side or the rest of the world, this is a tremendous burden that actually can cause economically. Now in 2016, unfortunately, we don't have treatment for non-alcoholic fatty liver disease. So the only treatment that people recommend is weight loss, which is not easy to do, or with lifestyle modification or dietary changes. But there is really a rush towards a effective treatment that's going to come up in the future, which is one of the sort of interests that we see in this area. Can we develop a safe, effective treatment for patients with NASH that potentially can progress? The second area that we're really pushing forward is, can we develop a diagnostic test for NASH? So in 2016, the only way that you can diagnose NASH is by a liver biopsy, which is expensive and also risky. So the hope is that we can actually do either an imaging test of the liver, or we can do a blood test or a combination of both, and can accurately diagnose that this is the kind of patient with fatty liver that can progress, and this is the kind of patient with fatty liver that will not progress. The one last point I want to make is that what worries me the most is the fact that there is a huge sort of burden that's coming out of the pediatric population in the United States. There is a high prevalence of non-alcoholic fatty liver disease in pediatric population, and some of these kids develop bad liver disease early on in life, and we need to address this.